Hi there, I'm Pamela Windle from Smarter Change, and I work with women to help them transition through perimenopause to postmenopause with ease. And today I'm here with Kathryn. Do you want to introduce yourself, Kathryn?
Hi there, I'm Kathryn from Arcadia Therapy. I work in the city centre of Nottingham and I deal with all sorts of aches and pains, but I'm here to talk to Pamela today about women's health physiotherapy, specifically pelvic health.
So, Kathryn, why is there such a thing as a women's health physio?
Well, because men and women are very different. Women, because of their anatomy, have generally more problems in the pelvic area than men, and also because of the biological role that we have of childbearing, that has significant effects on the function of the bladder, bowels, and pelvis itself, and the pelvic floor muscles. Down to the anatomy more than anything. So if you can see my pelvis, you can see there's a nice hole right in the middle of it, through there, which is the opening to the womb that all ladies have, but men don't. So you can see this red area is all the pelvic floor muscles, and the hole is sort of a hole in the integrity of the strength of those muscles. And so any damage to that area through childbirth or other things can weaken the whole structure, which again then affects our bladder and bowel. And these things are things that aren't seen to be very ladylike to talk about, yet lots and lots of ladies do suffer them. And so I'm here to hopefully promote that that's a normal or a very common thing to experience, and that there is something you can do about it.
Yeah. So what does it actually include then, coming to see you?
So depending on the problem, so for the moment, if we think about urinary incontinence, and that's leaking wee if you bounce, laugh, cough, sneeze, and often it's seen as a one-off, and most people don't really think it's anything worth dealing with. However, it's a sign that things might not be as strong or as balanced as they should be within the pelvis for long-term, for lifelong health, especially into the menopause, which is your specialism. Ladies find that their hormones change and the integrity and strength of their tissues change, and that's when a once-off becomes a much bigger problem. And sort of my role is to help educate people first of all about why this is happening, what's happening, what are the mechanisms, and also why it's so important, even at a much younger age, to start dealing with it. So the first thing I do is education. But what happens within the actual assessment is doesn't have to be all internal necessarily, although that is an aspect of the assessment. But we look at your whole posture, your whole structure, the effect of your breathing, your diaphragm on the pelvic floor, and how those two muscles, the diaphragm coming down as you breathe in and the pelvic floor supporting, how they're supposed to work in harmony, and quite often it becomes dysfunctional in both men and women, but as I say, more likely in women because of the obvious labours that we go through. So what I would do is talk to you about your particular issue, ask lots of questions about your bladder and bowel health, about your dietary health and activities, what sports you enjoy, and what your problems are restricting you from doing. And then we'll set that as a goal to get back to those activities and functions, and work out a strategy or plan to deal with your specific issue.
Yeah, and also I guess the other thing is stress management as well. Like you said about the diaphragm working sufficiently and optimally affects your pelvic floor muscle. So if you're constantly in a stressful state, then your diaphragm isn't going to be working properly, therefore putting too much pressure on perhaps a pelvic floor that's had some trauma through childbirth, and then also with the changing hormones as well. So how does physiotherapy help with incontinence? How do you help women with that?
So the pelvis itself, although it's seen as a bit of a black hole in anatomy books and in information, public information, it's actually bones, it's muscles, it's ligaments. So they behave in a very similar way to a stiff neck or a painful back. And we need to work with those bodily functions, both the bladder and the bowel, as well as the muscles themselves, to reinstate the harmony. That's basically what physio is to enable the body to heal itself. But we can do that in a number of strategies. And so as a sort of physical specialist, physios are well placed to do this. What we can do is actually assess the strength of the muscles directly, which is what lots of, say, Pilates teachers aren't qualified to do. So we do an internal assessment to test the strength of the muscles here. And we can ask ladies to sort of resist against tension or to do fast contractions, just like we would with any other muscle, and assess their baseline and where they are now. And that will give us a lot of information about what's weak. Is it weak after a long time of endurance, or is it just not firing as quickly as we'd like it to when a lady coughs or sneezes? And so that particular assessment will then determine their treatment program. And it's a case like any other muscle, as I say, of doing exercises, strengthening, and also if the lady really struggles with that, they really can't quite get the sensation of squeezing the right bit, then there are lots of sort of contraptions and devices that I can introduce or educate them about so they can help themselves going forward. But ultimately, it's an enablement program. It's getting them back to doing all the things that they want to do with their life and not feeling both physically and quite socially restricted, which can happen. And as you say, that emotional welfare as well. It's quite stressful, always needing to be near a loo, always having to worry about, embarrassing yourself in public. So that's a really important aspect that we consider in the whole rehabilitation program as well.
Yeah, and I guess you talked about correct exercise as well and how to work pelvic floor muscle, and there needs to be a theme, isn't there? It needs to relax, also needs to contract at the right time. And so a lot of women tend to, I know what it was like when I had my daughter, I was told to just squeeze the pelvic floor muscle. And that isn't everything, isn't it? We mentioned earlier when we spoke about Kegels. So, do you want to explain about that?
So Kegels are, they're the pelvic floor lift and squeeze exercise that were sort of defined by a chap called Mr. Kegel. And that is all well and good, and that may well be the right exercise for lots of people. But as you say, it's not just about squeezing and relaxing. Lots of ladies, for example, find it very hard to relax because of this trauma to the pelvic floor. In the same way that, for example, the neck gets tight and spasmed when people have whiplash, similar things can happen to the pelvic floor if they've been traumatized. It's very hard to relax. So just to do your Kegels, as you're told by a GP, might actually be making it worse. It might be making you tighter and tighter and unable to relax, which then might make you constipated and so on. So there's quite a lot of different things to consider, and everybody's an individual. And that's why the internal assessment is so important, because it's all very well to read a blog and say, well, I'll just give some squeezing a try, but is that actually addressing your problem, or is it making it worse? You can only know that by having a proper assessment in the first place.
Yeah, fantastic. And I think I loved what you said about everyone's an individual. We are completely individual. And, if you have incontinence or you have constipation, it might not be because you've got a weak pelvic floor muscle. It could be actually that it's over tight and that's causing the issue.
Yeah, and there's loads of other stuff as well that isn't about the internal assessment. And so it's not all about that. It could be something as very simple as taking your time to go to the toilet. Getting in the right position when you're on the toilet, because lots of people don't really know. And again, it's quite an unsavory topic, and people sort of sit upright and think, oh, I just hope this is over soon. Whereas actually it's a bodily function that, like anything else, needs to take its time. And so there's lots of information I can give, and there's lots of just little tweaks that might make things a lot easier in a relatively short amount of time. It's not all about the pelvic floor muscles, although that usually is an aspect of it. But the thing is, lots of people leave it for so long that it becomes more of a problem than it needs to be, and the solution doesn't need to necessarily take months and months and months.
Yeah, and I guess one thing that I try to teach my clients is that, to pay attention to the body, be really aware and be inside your body. And like you said, if they are fully aware of what's going on in the body, they'll know that something isn't right and there's something that can be done about it. And surgery doesn't have to be the only answer. There's alternatives, aren't there?
Absolutely, and surgery itself doesn't actually have the best success rate in terms of repair. They do repair the tissues and they can mesh them together, and technology is always moving forward about which meshes to use and whether the body tends to react to that. But actually, if the control of the pelvic floor between the brain and the nerves down to your pelvis isn't well-travelled pathway, then just stringing something together in a mesh long-term is not going to save that integrity. And I don't want to shout out of that because I'm not entirely sure, but a large proportion of gynecological repairs actually don't long-term last, and so ladies have similar problems, yet having been through the trauma of a surgery, which can cause other things like scar tissue irritation and so on, definitely worth going for the conservative treatment first. And discussing that with your physio, your GP, depending on the level of incontinence or prolapse you might be experiencing. Obviously, you want to get all the right support in place, but don't go for the most traumatic, which is the surgery first, because there is lots you can change. And it's actually been shown that if ladies have a prolapse, their actual prolapse degree might not change after all the physical therapy. However, their symptoms of continence, that painful feeling or dragging in the pelvis, actually do improve. So try not to focus on the degree of prolapse if that's the problem. Focus on the symptoms and what we can do to actually enable you to live a better life.
Yeah. So if a woman's watching our video and she's perimenopause or postmenopause, and she's never had a child, so she's never been postnatal.
Yeah.
She also needs to consider a pelvic floor muscle because of the drop in estrogen, which causes the ligaments to loose and potentially could have prolapse as well, as long as with a woman that is postnatal as well.
Yeah, absolutely. In the same way that lots of ladies, a proportion of ladies, have had children and have no problems. So yes, it's very individual again. And ladies who don't have children might be much more into their sports or have very stressful long hours of work, and all those things that we talked about earlier. So the diaphragm, the stress levels, also things like if anyone sits all day, their glute muscles, their bottom muscles don't maintain their tone. They just tend to lose strength. And the glutes are actually, if we look at the pelvis again, they sit around the back of the pelvis here, and they actually attach to your coccyx and create tension within the pelvic floor. So an external muscle, something that's very obvious and we think wouldn't be related, actually is quite important. So those ladies who've never had children could still have weak glutes, and that could affect their pelvic floor. Or they can have, a tight diaphragm or something, which again will create the wrong kind of pressure down into the pelvic floor itself. So don't think it's just for ladies who have kids. Certainly, if you're having symptoms, they can be helped, whatever your life situation. So, do try and find out, who's in your local area to help you with that.
Yeah, and also carrying extra weight as well. That puts pressure on the pelvic floor. So being overweight also is something to consider, particularly post-menopause as well. Yeah. So
and that's the difficult thing with postnatal ladies as well. The risk that people have is that, of course, you finally got rid of the baby in your body. You want to get rid of the baby weight as well. And lots of ladies rush out to boot camps and so on without really too much thought to pelvic floor. And if they do have thoughts to pelvic floor, discuss it with their GP or even sometimes with friends, they're told, well, that's normal, that's just being a mum. And actually, as I've described, it is an integral part of not just your pelvis, but in the way the whole body works in harmony. So it's very common, but it's not normal, and it's worth dealing with before you start doing star jumps and lunges and so on, because once the symptoms are there, they will start to get worse if you don't address them.
Yeah, even sit-ups and crunches, which a lot of people think that that's the right type of exercise to work their core or their abdominal muscles, and actually could be causing more damage than good.
Absolutely, yeah.
Yeah. So what would your one tip be, do you think, if you had one?
Well, I think you've said it, you've hit it on the head really, Pamela. It's listening to your body, whether it's leaking when you're on a trampoline, whether it's back pain that you thought would go away once you've had your baby, whether it's shortness of breath or tightness in your chest that makes you feel you can never quite relax. All these things are connected. So the first thing I think and the most important thing is to tune into your body. And once you've done that, you'll be able to start taking action and going down whichever pathway is right for you, because everybody's different. So yeah, take a moment if you can and just listen. And I think a lot of the time ladies will say, do you know what, I have been ignoring this for a while and maybe I should start actually getting it sorted. And you won't look back, you really won't. So do give yourself that time and thought.
Fantastic. So where can people find out more?
Well, my company's called Arcadia Physiotherapy, and I'm based in the city centre of Nottingham. My website is arcadia-therapy.com, and there's lots of information and blogs and so on there. I'm also on Facebook and Twitter. And if you wanted to book an appointment, you can do that through the website, or you can find my number on there and give me a call, or just pop by the clinic, which is in the Lace Market in Nottingham.
Fantastic. It's been great talking to you, Kathryn, and such an important topic that affects women, of all ages, all the way through their lifespan. So thank you so much. But just tell us again, where can we find you again?
At www.arcadia-therapy.com.
Fantastic. See you soon.
Take care. Bye. Thank you.
Bye.